It's a beautiful Sunday. It's a beautiful Saturday, 27 November 2021. Uh, in conjunction with World Prematurity Month, uh, this evening we are privileged to have a, ge- a, a guest who is a doctorate in public health, a mother of two, and a sufferer of endometriosis. Endometriosis is a common gynecological problem that occurs among women um, who are born prematurely uh, and this amazing lady has been been through her 10-year journey of endometriosis, and she's here with us. So let's put our hands together for Dr. Hardeep Kaur Dhillon.
Thank you very much for that very warm welcome, Rajvin and Waran. Thank you for having me on this show.
Hardeep, how was your day?
Wonderful. I've been preparing myself and I look forward to this session very much. Yeah.
Yay. So, are we ready to begin today's session? I'm so excited. Yeah. Let's move on to the first question. Tell us more about yourself.
Okay. I am Dr. Hardeep Kaur Dhillon. I'm a Malaysian, a Sikh Punjabi woman, and been married for 41 years to a very loving and supportive husband. We are blessed with two children, a daughter and son, who are now married with their own families. We also have a 3-year-old granddaughter, and we are looking forward to more additional to the family. I was born in Ipoh, Perak, and my father, late father, Pritam Singh Dhillon, was a civil engineer, while my mom, late Pritam Kaur Hundal, was a homemaker and a planter of a small holding oil palm estate. I am the second child in a sibling of 6 of us. I went to primary and secondary school in Teluk Intan Convent School, and then I had my first job as a temporary English teacher was at Pulau Langkawi, Kedah, before I left for my nursing career in UK. And it was while I was pursuing my post-registration course in midwifery at St. Mary's Hospital, Manchester, that I first experienced the condition endometriosis. I was 27 years old then. On reflection, this lived experience of chronic pain for the 10 years and later to undergo premature menopause at 37 kindled my passion towards exploring more about women's reproductive health, particularly its treatment and management. If I recall correctly, all my doctors had been male then.
That's very interesting to hear. Um, uh, from what we know, that you are an excellent person in public health. So basically, what is your job description, if we may ask you?
Sure. Now, currently, I am an adjunct senior lecturer at Monash University, Malaysia. attached to the school, Jeffrey Chia School of Medicine and Health Sciences, and involved in the MBBS program as well as health sciences. I joined this university in December 2007 as an academic coordinator and lecturer in a nursing program, a post-registration program. And then I moved on in 2010 and joined the medical program. And when I joined the program, I was expected to have a doctorate, and so I embarked on a part-time doctorate course, and eventually I qualified and became a doctor in public health. That is, in brief, how I came about to be teaching, researching, and being a clinician, teaching basic clinical skills to medical students.
Excellent, yeah. So, yeah. So every woman or everyone have their favorite moment in their profession. So, what was yours, Hardeep? Can you tell
Well,
us?
yeah, definitely. I found that with my clinical experiences, I had no problems developing a rapport with my patient and clients who trusted me enough to talk about their most personal and sensitive health issue. This was empowering them. By empowering them and being able to communicate with them, I was able to use my skills in providing health awareness and self-care public talks like this one that I'm doing now. Also, another moment, another favorite moment of mine is to be able to share all my knowledge over the knowledge acquired in nursing as well as dealing with medical students over a period of 31 years. So you can imagine how much experience I have. And also, I have been working for now coming up to 51 years in the fields where I am both an educator, clinician, researcher, as well as I have been a patient myself, receiving patient care. So these have been my precious moments or favorite moments.
Okay. Endometriosis. Moving on. Endometriosis is experienced by most women nowadays. Most women in the childbearing age. I understand that you 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 are amazing to go through uh, chronic pain associated with endometriosis. Both you and I have um, been through this, and that's why we are sharing our knowledge today. So, uh, what is your definition of endometriosis?
Well, basically, endometriosis is a chronic inflammatory condition. I would use the word condition rather than disease. And it affects women, of course. Now, if we can see the slide that shows the pelvic organ, that's the first thing I would like to bring the attention to of my audience, to say that it is important that every woman is aware of her body and knows where various organs are placed within her body, so that when she's visiting a doctor or googling some information, she has some idea as which anatomical organs are being discussed. So in the pelvic organs are, if you can see, there is the ovaries, the fallopian tubes. Ovary is where the eggs are matured, and the fallopian tube is where the eggs, usually the ovum, comes down into the uterus. And we then we have the vagina, in which the lining of the uterus called endometrium will be shed every month, and that's the menses. Also, you would notice that apart from the ovary, fallopian tube, the uterus, which is and the vagina, which is the reproductive tract, we also have the bladder, the urinary bladder, and the bowels at the back. So these are the organs that you would be referring to when you say or when you visit a doctor if you have this problem of endometriosis. Can I have the next slide? Okay, so briefly to say that what is endometriosis, you would notice that the lining of the uterus is called the endometrium, as I mentioned earlier, and every month this sheds. But due to some reason, I will mention the theories later, there is a backflow of this lining back to the fallopian tube into the ovaries, and then it sheds out onto the pelvic floor and various organs that are surrounding the uterus, such as the bladder that I mentioned, urinary bladder, and the bowel. That's the rectum and the anus. So this is what the endometriosis is basically happening, that instead of staying in the specific area where it should be, that is in the uterus, and coming out as a menses during menstruation via the vagina, it is now going backwards, and there's a backflow. So that's an abnormal process occurring instead of the normal physiological change, the physiological process of coming out from the uterus into the vagina and out. There is also a mention that it could be that the stem cells are responsible for this peculiar behavior that is, or I call it the extraordinary experience. And also another belief is that these cells, endometrial tissue cells or cells, they can migrate from this site to the rest of the body via blood supply or the lymphatic system. So that means this endometrial tissues can be found anywhere throughout your body, but mainly it is in the pelvic, but it can move to the abdomen as well as to the back. And sometimes it can go up right up to your lungs too, which is later in when I'm later on in your life, if you have experienced this in your 20s, the endometriosis in your 20s or in your teens, then by 35, if it is not treated properly, these tissues can migrate up to the lungs too. So this is what endometriosis is.
Yes, so it's a very, very thank you for the um, thank you for the thank you for the informative definition. Um, and if I may ask, I understand that endometriosis uh, affects women within the age of um, 18 to 35 or 18 to 40. So, uh, is that is that is that the age, or um, it can also affect older women?
Well, basically, any woman that is menstruating, irrespective of age, any woman that is menstruating is at risk of developing endometriosis. However, it is known that women mainly in the 20s and 30s, that's the reproductive age, that have this problem. However, we are now concerned and we are also thinking of teenagers. Some teenagers do have this problem, and they don't realize it. And this is why we are having this public talk, to bring the attention to anyone who is suffering from this problem, to seek treatment immediately so that long-term complications are curtailed early. That's what we are saying. And we are saying that we should be listening to the body when it's experiencing pain.
Yeah. So I understand that the bodily response, uh, the body has a impact on endometriosis. So uh, various signs, as in like nausea, based on my personal experience when I first got it. So, but now it's much better. So, but how in general, how does the body responds to endometriosis for the
Okay,
audience out there who,
yeah. If I can have the slide back that I was showing just now, where you have the various signs and symptoms. If we can have that slide. Yes, thank you. Basically, if you see that we have here sharp, deep pain during uh, during menstruation, as well as you find that there is pain, and it's chronic pain because it is happening all the time. Every month it is happening, the pain is occurring. So what had happened is that in 2018, actually, the doctors, researchers and doctors, they developed a questionnaire which has got 5 questions pertaining to a painful period. It's called Painful Period Screening Tool. If you can move on to the next slide, Warren,
next slide.
and the next. Yeah, this is the painful period screening tool that I would like to bring to your attention, so that you know that by answering these 5 questions, you will have an idea whether you probably have this problem, and you need to seek medical attention. So the questions that you may be asking yourself, or these are the things that you might be experiencing. Do you often experience pelvic, abdominal, or lower back pain before or during your periods that curtails your activity, or you require medication? If the answer is yes, the possibility of having endometriosis is there. The second question: do you often experience pelvic, abdominal, or lower back pain between your menstrual cycle or period that limits your daily activity, or you require medication? Then, if the answer is yes, most probably you do have endometriosis. The third question: do you often experience pain with sexual intercourse? Yes, no, or not applicable if you're not sexually active. If the answer is yes, probability is higher. Do you sometimes avoid sexual intercourse to avoid pain? If the answer is yes, most probably you do have endometriosis. And finally, do you often have pain with bowel movements before and or during your periods? And if the answer is yes, then yes, you probably do suffer from endometriosis. So the scoring for this questionnaire is, if yes to more and more, then you should take yourself off to see the doctor, consult a doctor, and most probably you may have the condition endometriosis. So this is one of the area in which you have to be observant and aware of your body. So some women may not pay attention. They may have some aches and pains and they consider this to be natural, or it's common and it's only women's problem, and just brush it aside. Now I'm pointing it out to you to say, no, it's not a normal thing that you should be having severe cramps to the point of taking medication to relieve your pain, or you are not able to function uh, doing your daily activity. And I will explain more in further detail. Warren, can we go back to the screen with signs and symptoms? The next one, the previous, no, the previous one, sorry, previous one, previous to this, that's it. So here you would see the signs and symptoms. I've talked about the pain, that you would have painful pelvic pain or abdominal pain or lower back pain during this time when you are having your menses, before, after. Now, the other thing that you might complain about is painful urination or passing urine. And this is because the endometriosis tissues have fallen onto the bladder and it is irritating your bladder. So you find that whenever your bladder is full, you will have some pain or discomfort when you're urinating. Again, some women will even have blood in their urine. So this again is an indicator that there is something wrong, something happening, because normally you don't pass blood in your urine, nor should you feel any discomfort or pain when you're urinating. Another symptom is also back pain. A lot of back pain, and sometimes this back pain can refer up to your shoulder, and you also have shoulder pain. And this is because the tissue, the endometrial tissues, have got into your muscles, and they cause ache, and they create tension, and therefore you get referred pain up to your shoulders. So you would be thinking, hey, my uterus and fallopian tubes are down in my pelvis. Why is it that I'm getting shoulder pain? So that means it's not as clear cut as to say, okay, you are having a gynae problem, because you are complaining of shoulder pain or back pain. So again, the symptoms are quite vague. They can be, they cannot be sort of situation. So this is why it is very important to know, to be aware that if you are having shoulder pain and back pain, there must be a reason more. If that is happening, if that pain is happening every month and it's always before, during, or after your menstruation. Another problem is intestinal pain. These tissues, as I said, they migrate out onto your pelvic floor and into your abdomen, and you find that women will have abdominal pain, intestinal, stomach ache, they will say, or when they go during ovulation, particularly mid-cycle of their menstruation, a menstrual cycle. And they also have this abdominal pain or intestinal pain when they go and urinate, or when they are opening their bowels. So again, when highlighting to you again, during sexual intercourse, because the vagina is close to the bladder, is close to the bowel, the anus and the rectum, you find there is congestion when there is penetration of a penis, and that also will cause the pain, especially during penetration and during intercourse. So these are signs that are telling you that, hey, there is something wrong here, because sexual intercourse should not be painful and it should be comfortable. Another area is mood swings. Now you find that if you are having this problem and you are on various HRT or hormone therapy, it can also create mood swings in you. And when you have chronic pain, you are not going to be smiling and laughing away. You probably have an expression on your face that is tense. It's showing an expression of pain. There's no smile. You are preoccupied. All these mood swings. Sometimes people don't understand what's the matter with you, because one minute you are happy and cheerful and the next minute you're grouchy and not approachable. You're just like a cactus. So this is another thing that women do suffer from, and therefore that affects their quality of life and their social interaction. Blood clotting is another issue that happens because of heavy irregular bleeding. Sometimes the blood becomes clot. They have blood clots. It becomes black, dark. It's stale looking, and it is stringing. So it's not a normal flow that of a menses, but an abnormal, a change in the menstrual flow. That if you notice it, then you should take yourself off to the doctor. Another thing is bowel action. Now, bowel action is another area where you suddenly find you have explosive diarrhea, or you get constipated, or you would have some blood in your feces, which is so abnormal. And it is also related to symptoms of endometriosis. Bloating is a very common symptom. Women will find that when they are approaching their mid-cycle and in approaching their menses, suddenly their abdomen is bloated and they cannot fit into skirts or trousers or pants, which they normally can do during other times of the month. So that is another indication that there is an accumulation of air, bloatedness, gas, and abdominal discomfort. The bowels are irritating, and people use the word irritable bowel syndrome when it is related to the abdomen. Also, the other thing that I would like to mention is leg pain. Because these tissues, they are also found, endometrial tissues, they are also found on nerves, on muscles, on ligaments, and they can irritate the nerves, particularly the sciatica nerve that is running behind you along your buttocks and down the leg. So that is another area that you should consider if you are having leg pain and painful periods. Now, infertility is one that has been mentioned many times, that yes, but not all women who suffer from endometriosis become infertile. There are women like myself, I was able to conceive and have children. And finally, shortness of breath that I mentioned, thoracic endometriosis. Like I said, these tissues, they can migrate and they can move in bloodstreams and lymphatic system into, and they can end up in your lungs, and they will function same as they would function in the uterus. And therefore you might find some people complaining of chest pain, shortness of breath, and also referred pain, shoulder pain. So, but this condition is very rare, and it occurs when you have had endometriosis for many years. Roughly when you're at the age of 35, 36, you might start complaining. So that will give you a rough idea as to what kind of symptoms you may be expressing, your body may be expressing, and some of them are so vague that you wouldn't even think it is related to endometriosis.
Moving on to the next question. I understand that chronic pain related to endometriosis, particularly endometriosis, affects a woman's career. Sometimes I do experience it as well. So, in general, how can it affect a woman's career? If a woman asks you this question, how can it affect my career?
Well, the women these days are very lucky compared to when I had my endometriosis in the 1970s and 80s. So, however, like I mentioned earlier, there are two perspectives that we need to take into account. One is the employer's perspective. The employer would want a very productive worker, a time manager, a person who is a team player. And so therefore they are looking for employees who would not be taking time off every month or every other month, or because they have pain, menstrual pain. So they can, to be using menses, which is a monthly affair for every woman who is menstruating, to use that as an excuse becomes a problem. And that is what happens when a woman has not got proper treatment or has not sought any treatment, is just dealing by taking some panadols and then hoping and coping. So that will not work well. The other issue is that medical insurance, you find that these employees will use up all their medical insurance coverage very quickly. And so you find that the HR will inevitably notice this, that this is one regular employee who is always bringing in invoices and medical bills. Also, if they attend appointments during working hours, that too will have a poor reflection. And the KPIs, of course, the KPIs is now the in thing, and they will say that you are underworking, underproductive, and therefore your performance is not up to par like the others. Invariably it will happen because they have taken time off or they are not at work. And when urgent meetings or work is deadlines have to be met and they are not there to check and make sure that it happens, and it's delivered. And sometimes when you have promotions and all that, these people will get overlooked because as far as their team and the manager is concerned, she's not there for all the time and she doesn't deserve it. That sort of situation occurs. But on the other hand, the sufferer, although she is in pain, she needs to take time off because she cannot work. So she is not a safe person to be working. So, in terms of risking herself and risking others around her, so that is one reason why they because they cannot manage, they cannot cope, they don't come to work. They feel guilty for not being able to pull their weight. And then they feel embarrassed if they have symptoms at work like painful periods and aches and pains and having or feeling tired. And all this does affect the woman. But having said that, with when you have managers and colleagues who understand what's going on, and if you can deliver whatever deadlines or whatever work, your duties, you're responsible, if you can deliver, then you should be able to continue working. They cannot deny you your job unless you are not performing at all. And so there is this balance. If you are aware you have this problem, I strongly advise you to go and get yourself treated. And there are lots of good treatment management there that can help you so that you do not develop some of these symptoms and develop complications later on in life.
Yes, very, very very in in informative sharing so far. Mine, some of them are saying all of them are saying very informative session and very inspiring. So, talking about the pain management of endometriosis, pain management can be managed, manage, manage pain management for endometriosis can be managed in various ways. So, how did you manage, based on your personal experience here? In one or two sentences, how did you manage endometriosis?
Well, it's difficult to explain in one and two sentences, but I will try. Simply because of time constraint, I will just say to you how I manage or what is the management available. First of all, you must make sure that if you have endometriosis, and particularly if it's scattered in other parts of the pelvis, the abdomen, then you have to make sure that you are on some medication that stops the menstruation for a period of 3, 6, or 9 months. Naturally, I have been told that the natural way to stop it is to become pregnant. So you have 9 months of pregnancy, which will then naturally stop you from menstruating. But that was okay in the past because a lot of women stayed at home, had their children at home, they stayed at home and had a family, large family. So those women who did have endometriosis, it never showed up. Whereas we, as career women who have put our careers first and we are developing ourselves in terms of our career, we find that if we run into this problem, first get it diagnosed. Diagnosed means investigation. Investigation means money, money to pay. So make sure you are medically covered, that you have an insurance so that you can go to the private sector. If you wait for public healthcare services, it might take time. It might even be postponed or long waiting period. So investigations, and what sort of investigations? You can have a pelvic floor, you have the pelvic examination where the doctor examine you internally. Then you have the ultrasound scan. It is done abdominally if it's abdominal symptoms, and vaginally if it is vaginal symptoms. There's MRI, and all these cost money. So if you have a health insurance, a medical insurance coverage, then you have no problem about the cost. And then the one that diagnoses this problem is a laparoscopy. A laparoscopy is a tube that is put into your abdomen, and then they do an inspection to see if there are any endometrial tissues outside the uterus. And then they can do a biopsy, and some of them do lasers and diathermy, and to get to remove to remove the implants, the endometrial implants in various organs, so that they do not damage. So you asked me what sort of care did I get. First of all, I started having my personal problem. I have to explain before I can tell you about the treatment. Is that I was perfectly all right until I was I was working, doing a course, and I was 27 years old then, happy, carefree person. And I started getting this bloating and abdominal distension that I have described. And I had constant nagging pain on my left side, around the waist. And this would get worse while I was asleep. Or while I was asleep, I will wake up with this pain, or when I'm lying down on the bed. And with this constant nagging pain, it would also come before or during menstruation. So I went off to visit the GP, who then decided it is an abdominal symptom, this bloatedness and all that. And he sent me to a surgical team who examined me and called it irritable bowel syndrome. And I thought to myself, irritable bowel syndrome? I don't have any constipation. I don't suffer from diarrhea. What sort of diagnosis is that? After a couple of visits, then they gave me some medication and all that, but the pain was still there. So they referred me to a gynecologist because they had suspected endometriosis, whereas I was ignorant. And so I toddled off to the gynecologist, and he got me to do some investigation, radiological investigation. And he said, yes, there is a mass on your left hand side. So we at that time there was no ultrasound, MRI, and all those sort of things. So I had to have a surgery. I had to have surgery. It was called laparotomy. That means examining opening the patient up and seeing what's the problem. And if you can imagine, I was on my own in UK, and of course my colleagues and my tutors were great, but there I was with this problem. And when I recovered from anesthesia and when I saw the doctor, he said to me, "I'm sorry to tell you, but we had to remove an ovary and fallopian tube because it was totally damaged. And what you had was a cyst, and they call it the chocolate cyst because the blood that has been accumulated in that tissue is all blackish, brownish, like a chocolate. So they call it the chocolate cyst, and they said it was the size of a grapefruit. So once that was removed, I was then put on on medication called Danazol, which stops my period. So it works on my brains to stop the follicle stimulating hormone, to stimulate my ovaries, to release ovaries, that also works on the endometrium of the uterus. But I never really took painkillers as such. But if I did, it was just Panadol or Ponston. Once the surgery was done, there was no more pain. But the diagnosis was confirmed because they saw endometrial tissues in the pelvic as well as in the abdomen, but more so in the pelvic. And of course, I found that the oral medication I've been taking it for a long period of time. I was 27 and I didn't get married till 4 years or 5 years later. And so I had been on this hormonal therapy. And that is what happened to me. In terms of pain relief, I've already mentioned, but also I made sure that I was relaxed, happy, like I mentioned, I was a carefree person. That disposition remained with me. I was always smiling, as you can see me smiling. I was always friendly, but that was not all the time. When I was in pain, I was grouchy and miserable and unhappy. Yes.
Uh, So, my second last question is, describe the darkest moment when when your endometriosis diagnosis was made.
Well, obviously, when I was told that one ovary and fallopian tube had disappeared, that means removed, that means my chances of conceiving was 50%. At that time, I was single, no steady relationship, and although there was a very good friendship, but it wasn't a stable relationship yet because I was not married to that person. But what is so wonderful is that when I have a great faith in faith in God, and if He takes something, He does give something in return. And during this journey, I met a guy who was also in UK studying, and he was there for me. And throughout this journey that I was going through, he was there for me all the time, supportive, encouraging, and no, believe it or not, he was the guy who was with me when I had my surgery, and I ended up marrying him, and having my children. And yes, he is a loving and very supportive guy. And I must admit that when I'm not able to deal with my children, he is there making sure that they were not denied of the love and care and play that they should be getting. And in terms of my decision, I did have two children, a daughter first and then a son. But I found that subsequently, after my son's delivery, the endometriosis came back. And by then, I was 37. I had come back to Malaysia, and I decided that enough is enough. And I was actually unable to deal with the chronic pain anymore. So when the gynecologist suggested a total hysterectomy, that means removal of the reproductive organs, I just opted for it. So I reduced my chronic. I mean, I no longer had chronic pain, But with premature menopause, there are other issues which I will hopefully will get to discuss another time. But yes, and it's all in the past now. And memories fade away. They are not as bad as I feel now. I feel good now, but at that time it was bad. Yes, and
Okay, very excellent, excellent and informative sharing. Any final words?
yes, I would say that be mindful. Be mindful and listen to your body. That means you have to be aware of your body. And when you feel pain, because pain is not normal, when you experience pain, whether it's physical, psychological, emotional, mental, or any other, or spiritual, any pain of any kind, be mindful and listen and seek medical advice for early treatment. It's vital so that you do not end up having any long term complications that I have mentioned. All these things can be avoided or prevented if you maintain your visits to the doctor, take your medication, your hormonal therapy, whatever the doctor suggests, your pain relief, your holistic approach to life, and incorporate laughter yoga as part of your integrative medicine. And we know laughter is the best medicine. So, philosophically, I will end up by saying I was able to find a purpose of these experiences in my life. I changed the disadvantage, that means the endometriosis and the chronic pain, to my advantage. Through my faith and perseverance, I ended up exploring and finding out and doing my PhD on women's health. And this led me to what I find that today I have both my career as well as a developing family.
Thank you for sharing, Dr. Harjeep. That brings me to my second, to our second segment of this show, an evening with Rajvin and Waran. Thank you for those who are still tuning in. Uh, we are we are in the laughter exercise section. In the laughter exercise session, I'm going to bring you two laughter exercises. One is pain laughter, and one is love yourself laughter. Everyone, follow me. When you experience chronic pain, you hold any part of your body and start laughing. Ha 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 ha. For example, you have abdominal pain, you start instead of grouching and instead of instead of instead of grouching and instead of saying like you are feeling so much pain, you can do it like laughing. You hold it for 5 minutes. Take a deep breath and go. You hold the part of your pain and go ha 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 ha, ouch, ha 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 ha, and then you say very good, yeah. And then the second one is love yourself laughter, because when you are in chronic pain, from personal experience, when we are in chronic pain, we tend to forget to love ourselves. So hug yourself laughter uh, is is a good exercise for uh, to relieve the pain to a certain extent. So everyone, hold your heart and hold your shoulders and hold your heart and give yourself a tight hug and said, I am well, I am happy, every little cell of my body is happy, every little cell of my body is well. Ha 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 Very good. Yay! That was a little bit of laughter for you. Um, um, Lee Jin says that love yourself. Laughter is a value-based laughter. Agreed, Teacher G. Lee Jin. Thank you very much for your guidance. Um, Shumei Go says that thanks for the lovely sharing. Before I end today's an evening with Rajvin and Waran, before we end, I would like to uh, say that how I ma- how I manage chronic pain uh, based associated to endometriosis from personal experience. Number one is I practice gratitude. Number two, apply self love and um, take painkiller and take pain medication, as in your uh, hormone tablets um, on time and when when necessary when necessary regularly, and do laughter yoga every day as often as you can, like I practice it, and apply cold or hot pad in the affected area. Um, Lastly, as finalist for Miss Amazing Malaysia Season 2, I believe that step up and never give up. Chronic pain is an inevitable, but suffering is an option. So manage your pain associated to endometriosis well today. Thank you for listening. Stay tuned for Rajun and Warren next month, 11 December, and uh, we have another interesting guest who will share her interesting story, and as well as for the years to come, 2022 onwards, we have interesting guests who will share stories like Dr. Hardeep. Thank you very much for listening. Sat Sri Akal, Nandri, Thank you.